Hi, this is Sarah Meixel, and today we're here with Dr. Daniel Linhares. He is a professor at Iowa State University. So thanks for being with us today, Daniel.
Thanks for having me.
Very good. Tell us a little bit about your experience in Brazil and what role diagnostics play there in kind of controlling and or eliminating diseases.
Yeah, so briefly, Brazil, we have a 1.6, 1.7 million swine industry over there. I had the opportunity to work in the swine industry in Brazil for about 8 years. And it's good to remind that in Brazil we don't have PRRS virus, we're also free of TGE virus, porcine delta coronavirus, we're also free, and also PED. And so we deal a lot with bacterial diseases and with flu and porcine circovirus, combination of those two viruses and a lot of bacterial diseases. And so we use there is a lot of use of diagnostics. There are several private labs and labs from connected with the government or official labs to do surveillance, monitorings, and help people understand what are the diseases that are in their system and how to better control and eliminate them.
Very good. And is this something that are diagnostics used on a pretty regular basis? Are swine veterinarians recommending diagnostics to their producers?
Yes, I could say that yes, and then could also say that over the past 5 years that has been a growing need of demand as people are understanding the value of really understanding what are the specific diseases they have, and not only if they are positive or negative, but also going to the typing and understanding what are the subtypes of Mycoplasma or flu or Haemophilus parasuis and all the other bacteria there. And there's a growing need of diagnostics as a tool to help vets and producers make decisions on how to go forward.
Very good. Now, can you give us an example of one disease or one pathogen that is being used with diagnostics?
Yeah, I could think about some examples for Mycoplasma hyopneumoniae, for example. We use a combination of serology and PCR to understand over time what's the pattern not only of seroconversion or seroprofile, but also the pattern of shedding or detecting the DNA by PCR in nasal swabs from pig populations over time. And that helps to understand when is Mycoplasma gaining momentum or when seroconversion is going on and when active disease is going on. And that helps to strategically position vaccination strategies and also antibiotics. We want to reduce the number of antibiotics. So if you really know, based on those diagnostic evidences, when the disease is gaining momentum, we go strategically a week or 10 days in advance and position our health control interventions right there. So as you can see, we use diagnostic in different ways for monitoring, for guiding decision on how to position out the health interventions, and also to better understand the compliance, were the animals properly vaccinated, and things like that.
It sounds like it's used quite extensively.
Yes, it is, and we are fortunate that over there we don't have the veterinary diagnostic labs as we have here in the United States, but we do have several private labs that are doing a very good job on updating the PCRs, on bringing in ELISAs and working on the pathology side as well, developing tools to understand what's the role of the pathogen in that specific disease, if we can find the pathogen in the lesion and things like that. And so there's a growing need, I would guess, of diagnostic use and demand in Brazil. And I think the swine industry there is still opportunities for improvements, of course, everywhere it is, but we've been trying to use as best as we can and apply the best as we can the knowledge that we gain from diagnostic monitoring and so, for decision control in the field.
Very good. Well, thank you so much for all the information today, Daniel.
My pleasure. Thanks for having me.
This is Sarah Meixel reporting.